I've been using lasers for a long time in dentistry and for hygienists. Hygienists always have had the issue of doing full mouth scaling and root planings, but having a problem with healing in certain areas. Patients would come back, they wouldn't have, their 6mm pockets would be maybe at a 5 or maybe still at a 6. We couldn't figure it out. The problem with us is that we would always take it personally and feel like we failed in an area because we didn't get that pocket to reduce. So with lasers, what that has helped me to do is change what I had been doing with treatment with patients before. Lasers have helped me to heal my patients. They've helped me to go home, send my patients home with less pain, less discomfort. And for the first time, when patients are coming back now, they don't have the pocketing that they had before. I'm able to resolve those areas, make patients feel better faster, but yet when I'm reprobing those areas, I'm not seeing those 5s and 6s anymore like I used to see in the past. I'm now seeing resolution in pockets like I couldn't get before, infiltration involvements. I'm seeing regeneration of some bone in some areas that I've never, ever as a hygienist been able to resolve before. And to be honest with you, it is awesome for me because my patients are going home already starting to heal and they don't have the discomfort. For weeks, patients would say that they'd be sore. They'd say that they'd have constant irritation. They wouldn't want to do the flossing that we send them home with in the home care because they were too sore to do it. With the laser, the healing is so fast now that they are able to do their home care and resume that home care regimen so much faster and feeling awesome in the process. So I'm getting some really amazing, amazing results with lasers. The other thing that I'm doing with lasers is I'm doing the laser bacterial reduction. And with that, that has been key to a great success because not only am I using the lasers for periodontal therapy, but I'm using it in my general practice every single day, all day long, doing the laser bacterial reduction. So if you have a patient that comes in and for many, many years they had been taking pre-medication and all of a sudden the physician says, well, they don't need to take the pre-medication, but we're still concerned because of their autoimmune system and the concern with maybe the level of reaction of bacteria and us stirring that up. The concern becomes that maybe there's some bacteremias that could be causing some medical issues. So now what we can do is use that laser to do the laser bacterial reduction. We go throughout the entire mouth and we reduce those bacterial counts so you ensure your patient's better health. You're killing that bacteria, you're getting them healthy, and you're able to better know that you're not going to make your patients sick when they come in to see you. So I've had several lasers. I've been working with lasers for about 9 years and just recently brought the Ulta into our practice, and it has been a game changer for us. I am now able to do things with this laser that I have never been able to do in the past. And one of the big differences with the Ulta laser is being able to control temperature. Temperature means less discomfort for the patients, and for me, the most important part about treating that patient is that they're not going to feel pain and they're not going to feel discomfort. Let's face it, in dentistry, patients don't want to come back and see you if they're going to have pain and they're going to have discomfort. They want to know when they come in that we're going to be able to make them comfortable, we're going to be able to make them healthy, and they're going to want to come back to see us. And with the Ulta laser, now with the temperature control that I have, and the way that we can initiate the tip, that is the other key thing that has made this laser amazing. In the past, I've initiated the tip and I think that I'm working well through the pocket, and one of the problems that I've had is being able to make sure that I'm cleansing that pocket out and removing that tissue. And in the past, I haven't ever known whether I've really gotten that very effectively because it's left tissue behind. Now when I go through the pockets, I'm working twice as fast. I'm working way more efficiently than I've ever worked in the past, and my pocket reduction is amazingly better. It has really, really been a game changer for us, and it has really, really increased the success in our practice. So for me, Ulta lasers are the only choice. The difference in the laser and the cost of the laser is definitely at a premium, but the key that everyone needs to understand is this is not just a diode laser. This is a game-changing laser that is helping the success of our practice. You can charge more for this laser due to the comfort that the patient is going to get and the success that this patient is going to get. They can't go down the street and get the same treatment that they can in your practice. And you can talk to the patients about that and explain to the patients why you are charging more for your procedures. But regardless of whether you decide to charge more or not, your patients are going to get a much better treatment, much more success, and the abilities that you're going to have with this laser versus any other laser on the market are absolutely amazing. I have had so many lasers over the years, and none of the diodes that I have in our practice compare even closely to the Ulta laser. It is awesome.